This is a brief overview of the GastroPanel test, which is a recent innovation of BioHit Healthcare intended for first-line diagnosis of patients with dyspeptic syndromes. It's equally suitable for screening of subjects at risk for gastric cancer. Dyspeptic symptoms are among the most common complaints in present-day medicine, causing significant morbidity and mortality and thus having a huge impact on global health economics. The GastroPanel innovation is based on long-term target group studies run in Finland to follow up the outcomes and sequels of patients complaining of different types of upper gastrointestinal symptoms. These symptoms are collectively called dyspeptic complaints, and these may result from quite different underlying causes. From the clinical point of view, the most important single disease of the stomach is atrophic gastritis, being a significant risk factor of gastric cancer. The prime use of the GastroPanel test is in the first-line diagnosis of subjects reporting dyspeptic symptoms. Compared with alternative approaches, for example, gastroscopy screening, GastroPanel has several advantages. Being a simple blood test, GastroPanel is a non-invasive diagnostic tool capable of distinguishing patients in whom gastroscopy is mandatory, that is, those with atrophic gastritis. In a screening population, these represent a small minority, however, and reserving gastroscopy for these patients only, GastroPanel produces substantial cost savings in healthcare. In the management of subjects with dyspeptic symptoms, GastroPanel is an essential part of a clear-cut algorithm among general practitioners. Patients testing negative in GastroPanel but still having symptoms should be directed to other examinations, possibly colonoscopy, whereas the patients who have specific abnormalities are referred for gastroscopy. GastroPanel is a simple, non-invasive blood test with proven accuracy in diagnosing Helicobacter pylori and other specific stomach pathologies, including gastritis and mucosal atrophy, or atrophic gastritis. The GastroPanel test results provide important added value in estimating the risks of gastric cancer and peptic ulcer disease, as well as malabsorption of vitamin B12 and several trace elements, iron, zinc, and calcium. The excellent performance of the GastroPanel test has been established in extensive clinical testing of over 50,000 subjects worldwide. GastroPanel is a simple ELISA-based blood test, and the results are interpreted by a statistical software, GastroSoft, giving a written report with interpretation. This report is intended for guidance of the doctor in the management of the patient. The GastroPanel test results in substantial savings in healthcare costs, while making a distinction between a healthy stomach and those conditions that necessitate gastroscopy. The GastroPanel test also helps focus the proper diagnostic tests and management of the patients in a more efficient manner. The cost-effectiveness of the GastroPanel test strategy is easy to evaluate, based on large population-based screening surveys giving accurate figures for different gastric conditions. Beyond doubt, as compared with systematic population screening by gastroscopy, testing with GastroPanel is a viable and cost-effective strategy. There are several methods by which the local distributor of the GastroPanel test can also benefit. Most importantly, dyspeptic symptoms are very common among the general population, and GastroPanel is the right test to distinguish those who really benefit from gastroscopy. The GastroPanel test is based on ELISA technology. It's technically simple to perform and requires a minimum of patient preparation before taking the blood sample. It's important to advise the patient to discontinue eventual treatment by proton pump inhibitors or histamine 2 blockers. The GastroPanel test is adaptable for several commonly available ELISA automates. This assay is a panel of 4 biomarkers that are specific for the stomach and show a highly diagnostic pattern for various severe and less severe conditions and disease states of stomach mucosa. The GastroPanel test is well validated in large-scale clinical studies conducted in different populations and in different countries. With few exceptions, all studies reach very similar conclusions, substantiating the claim of the GastroPanel test as the first-line diagnostic test for patients with dyspeptic complaints. The key studies supporting the above conclusion and validating the use of the GastroPanel test are listed here. A study protocol based on 100% biopsy confirmation is currently under discussion with several centres in Europe and elsewhere. The NPV, or negative predictive value, is important for a diagnostic test. For GastroPanel, this is around 98%, implying that a negative test precludes a significant clinical disease with that level of probability. On the other hand, if the GastroPanel test is normal, there is a 98% chance that the stomach mucosa are healthy. Based on a Finnish innovation, the GastroPanel test is rapidly spreading over the world. This includes all European countries, as well as over 50 other countries where approvals have been granted or are under process. The test derives its name from its contents. The GastroPanel test consists of 4 biomarkers: pepsinogen 1, pepsinogen 2, and gastrin 17, that are specific for gastric mucosa measured by the ELISA technique in a blood sample. Included in this panel is also a test for Helicobacter pylori, HP IgG antibodies that measure the exposure, previous or ongoing, to this carcinogenic bacteria colonizing gastric mucosa. Gastrin 17 can be measured in 2 modes: fasting, G17B, and following a protein stimulation, G17S. The GastroPanel test is a simple blood test that measures stomach-specific biomarkers and provides diagnostic information to assist general practitioners in their frequently difficult task of detecting patients at risk for severe gastric diseases. This user-friendly diagnostic test is highly cost-effective, while only recommending gastroscopy to those patients who really need it. Thank you very much for your attention.